Doctors/nurses/Redditors, what has been your most gory, disgusting or worst medical experience? This kind of doesn't fit the topic, but kind of does. My mom used to work at a teaching hospital in the perfusion department. This meant students held a pig lab where they would practice their work with pig blood. Now, there's some sort of flushing process that occurs with the blood. I'm not really sure how they dispose of it. Well, construction crews were nearby building a new facility. One of the workers must have hit a pipe, because this blood starts spewing everywhere. My mom gets a frantic call because they thought it was human blood, which would have been much more dangerous. They were told the situation, but I'm sure there were lots of pants shitting around the site that day. I have two. Med student here. Number 1. A super obese, that's an actual medical term, woman comes to clinic complaining of a foul odor that she's noticed. And yeah, me and the attending noticed it too, a smell somewhere between rancid milk mixed with rotting fish and a disemboweled skunk swimming in garbage. We do the usual workup, take a good history, do a thorough physical, as best we can given she is huge and has folds and folds of fat and skin draped all over her, including rectal/genital exam just in case there was some funky down there growth, and run some simple labs. As me and the attending are discussing how we have no clue what is going on, the nurse comes out holding a green, soggy mush in her gloved hands and waves it in front of our faces. I nearly puked right there. Turns out the woman was using pieces of bread to soak up sweat by putting them in between her fat folds. Apparently she forgot about one of the pieces, which then stayed there to marinate in her juices for weeks, as estimated by the patient. I was sent in to see if there were any more hidden pieces. Luckily there wasn't, but having to lift up and search every fat fold was as embarrassing for her as it was disgusting for me. Number 2. A guy was drunk, fighting with his girlfriend, and decides to light up some M80s and throw them at her. Well, he waits too long after lighting one and ends up blowing off his hand. He's brought to the ED, completely drunk and having lost a lot of blood. We stabilize him and take him to the OR. While the hand surgeons are cleaning off his stump of a hand, me and the surgery resident are fixing all his chest wounds. One of the hand surgeons says, "Wow, this is a mess. Did anyone at the scene find his thumb?" No one knows. We continue examining, cleaning and suturing his wounds, and lo and behold, buried in a deep wound in his upper abdomen is 2/3 of the guy's thumb. If he hadn't been so fat, his thumb would have likely entered his peritoneum. TLDR number 1, super obese woman uses bread to soak up sweat in between her fat folds and forgets about a piece that eventually starts rotting and smelling so bad that she comes to clinic complaining of a foul odor of unknown source. Number 2, guy is too slow throwing a lit M80 and ends up blowing his thumb off into his own belly. I saw a man just after he was burned in a boiler explosion. His skin hung in strips off of his body, as if it had slipped off, like how easily the skin of a tomato slips off after it is boiled. Underneath was glistening pink/red flesh. The room smelled of cooked flesh and mechanical grease. The poor man was aware and moaned/screamed in pain. It was terrible. I want to tell this story because I feel there is very limited knowledge about when it is appropriate to withdraw care on your family. If any of you take anything away from this, please write a living will and talk to your loved ones about your wishes. A man brought his 92-year-old mom to our hospital because we were renowned for our outcomes. She had some pneumonia and was placed on a ventilator, breathing machine, to help breathe. Numerous antibiotics and drugs were given to help the lady as her son wanted everything done. She stayed on our unit for weeks breathing and eating through tubes with incredibly advanced dementia. Every time we came into the room or spoke to her you could just see the fear in her eyes. Every time we had to turn her vent settings up as she got closer to dying, we talked to the son about withdrawing care. He denied. Never. This was his mom and he did not want to let her go for any reason. He started yelling at the staff and we had to escort him out a few times. Yet since he was appointed as the decision maker in her living will, we had to continue to ask him to make decisions about his mom's care. When his mom was literally days away from death, maxed out on every drug we can give, we asked him to withdraw care on his mom. He punched me in the face. Later that day we performed CPR on his mom, breaking 4 of her ribs and she died anyways. The rest of the family watched us do this in horror to their mom because the son could not withdraw care. When you are appointed to make decisions in a living will, it can only be up to you. We could have withdrawn care weeks earlier, giving her a peaceful and restful death. If we are all going to die eventually, we should have the respectful choice to decide when we no longer wish to be cared after. It is therapeutic. Sometimes, enough is enough. TLDR, ask your parents what care they want and under what circumstances. And please, fight for that. I work as a paramedic in Canada, more specifically Ontario, and we were dispatched to a call by police for a code 4, emergency, code 5, obviously dead, and requested to bring a box of N95 masks. My partner and I were quite confused but did as we were told. When we arrived on scene, a police officer met us outside, and when I handed him the box of masks, he looked significantly relieved. My partner asked what was going on, and the officer directed us to the door. Within 2 steps of where we were, we began to smell it. That oh so obvious smell of death that has had time to fester. At this point we understand the request for masks, and as we poke our heads through the door we are greeted by a clearly deceased human, we are assuming. It was a woman who probably weighed on the light side of 400 pounds when she was solid, which at this moment she was not. The officer proceeds to tell us that she hasn't been seen or heard from in 2 weeks, and when someone finally came to check on her, they found her as a puddle. To make matters worse, she had her heat blasting. It was the middle of summer and temperatures can get up to 30+ degrees Celsius or approx 86 degrees Fahrenheit, and she had all her blinds open and she was seated in direct sunlight. It was probably the most disgusting sight I had ever seen. One of the most horrifying things I have ever seen in the hospital was a guy who OD'd on one of his prescription medications. One of the side effects was priapism, erection lasting more than 4 hours. Once the doctors got his cardiac and respiratory systems relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn purple/black/blue. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his penis. Not 1 shot. Not 2, or 3, or 4. 19 injections into the head of his penis. It was still swollen, bruised and red 2 weeks later. I did not witness this firsthand, but the most disgusting medical-related story I've heard from a practitioner who actually lived to tell the tale. As part of my training to be an assault crisis counselor, a doctor came in to give a presentation about STDs and STIs. Somehow he veered off the main topic and starts telling us about the things he's seen in his time. A female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a prostitute. The patient further disclosed that in order to continue working while she was on her period, she would put a sponge as close to her cervix as possible to absorb the blood and other menstrual-related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. The doctor figured it would be a routine matter of removing a foreign object that had become lodged or stuck, and takes the patient into an exam room to perform the extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her menstrual discharge, and that the same sponge had been in her vagina for 3 months. When the doctor finally managed to remove the car sponge, which had turned into black, semi-solidified mass due to excess absorption of nastiness, it also released a torrent of fluids that had been marinating in this woman's vagina for 3 months, and the fluids gushed out and nearly covered the entire floor of the exam room. The doctor told us that it was the first time in his 20+ years of practice that he actually vomited while performing a medical procedure, and that the stench from that room was so foul and pungent that it filled the entire clinic and made a seasoned nurse, who was standing in the hallway, vomit. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. TLDR, doctor pulled out a car wash sponge a prostitute had left in her vagina for 3 months. I'm not in the medical field, but I have a chronic illness that lands in the ER very frequently. The hospital I frequent most is in the middle of Baltimore. I've seen guys walk into the ER with a gunshot wound to the head, complete with brain matter glopped on their shirt, and falling out of their new head hole. I've seen a crackhead with a large abdominal knife wound stand up to leave the ER, only to have a large portion of their intestines fall out of their abdomen and onto the floor. I've seen a tremendously fat woman with her entire leg rotted so bad that the smell alone was enough to make you vomit, and it stuck to my clothes for several bleach washings. I've seen a gang member come in with a flesh wound gunshot, only to have a rival gang member come in and finish him off. All the horrible nastiness aside, the staff at that ER are totally amazing people, who are very kind to me. Many know me on a first-name basis. Isn't that pathetic? I'm there that much. The past few times I've gone in, which, thankfully hasn't been necessary in quite a while, they've been really cool and put me in the far back corner room, away from the crazies, the gang bangers, the druggies. It's a rare thing to actually get a peaceful moment in the ER. I have a lot of respect for all you frontline workers. Thank you for what you do. Stories from Dr. Friends. 1. Guy was scratching his hemorrhoids with a 50mm bullet and it got stuck up there. Since it was a live round, The bomb squad was called and held their blast shields or whatever around the patient's butt as it was removed. 2. Couple wanted to make perfect/custom DL do for guy's butt, so they put a condom in and fill the condom with cement. Condom breaks and almost a foot of his intestines has to be removed. My mom is a nurse in the ICU. One day, she got an elderly patient that was in terrible condition. The woman's toe was literally rotting off while still attached to her foot, and most of her body was covered in dried shit. In some places, the shit was literally inches thick. She was also half starved and had bed sores from not moving. The most horrifying part is that this old woman had been living with her own son the entire time. She'd fallen down in their kitchen, and he had just left her there. This is a story, which kind of fits into this. I heard of a friend's father who was an EMT. He was an experienced paramedic and seen a lot of gore. One night he was working, he gets a call to a motorcycle accident, caused by an elderly driver. The biker was out cold and had essentially scalped himself from the forehead to about halfway across the top of his head. He was actually okay in the end. But, a policewoman came over to ask if the biker was okay. The paramedic grabs the scalp and uses it like a ventriloquist doll saying, "Do I look okay?" The policewoman proceeds to go into shock and start vomiting. I know it's cruel, but I laughed, while being disgusted, when my friend told me it. As always, thank you for watching. Please like and subscribe if you enjoyed the video, show your support. Leave your thoughts and opinions down below.